Hello anatomy friends, this is Dr. Alsup, and in this first video for the supplementary dissection videos of the back and spinal cord, we're going to focus on the osteology that does not include the vertebrae. We're going to have a separate video for that because we have quite a bit to talk about there. So we're going to have a variety of bones that we're going to work through, but that a lot of times have attachment points or something significant to this session. So we're starting with the scapula. The scapula is going to be that we colloquially refer to as the shoulder blade, and we are looking at a posterior view for both of these images. So we're seeing kind of the spinous processes in the back of the vertebrae and the back of the scapula as well. And you can see where it's articulating with the humerus as well as the clavicle. So important articulation sites there. But what we want to focus on in this posterior view is this fairly prominent structure called the spine of the scapula. The spine of the scapula is palpable, so if you kind of pat yourself on the back, you are likely going to feel the spine of your scapula. It will extend laterally and eventually become the acromion or the acromion process. The spine of the scapula is going to be the distal attachment of the trapezius, or one of the distal attachments of the trapezius. And we'll talk about this in a bit more detail in the musculoskeletal portion of the course, but you'll have rotator cuff muscles sitting on either side of the spine. Also palpable from this posterior view, you can feel the medial border of the scapula. And sometimes you can actually see the medial border of the scapula in some very thin individuals. And really you can watch this medial border during protraction and retraction of the scapula to see how much range of motion is occurring there. So that with protraction, the medial border would move away from the midline, and with retraction, it would move towards or back towards the midline. And I know I'm looking at the medial border as opposed to any other borders of the scapula because, well, it looks closer to the midline, first off, because we always know those spinous processes are going to be towards the midline. Also, this region right here, the glenoid cavity or the socket portion of the shoulder joint, has always got to be facing laterally. So that border that is opposite to the glenoid cavity is going to be the medial border. All right, moving to the humerus, and we're looking at all anterior views here. And this image I just put here kind of for context so you could see that the humerus is going to articulate or proximally articulate with that glenoid cavity of the scapula. And here we know I wanted to show the entire bone because I wanted you to be able to see the difference between the proximal portion and the distal portion of the humerus. And one of the most dominant structures of this proximal portion is the head of the humerus, which is going to be the ball portion of this ball and socket joint here. It's a bit more complex when you look down into this distal region for its various articulations here. But our major focus is going, and we're just looking at a closer up view here of this bone, is I want to focus on the intertubercular sulcus, which is going to be this sulcus or divot of bone in between the two tubercles on the proximal and anterior portion of the bone. So this is the greater tubercle, this will be the lesser tubercle, and in between these two you will have this sulcus. A few things happen here. On this lip of the sulcus, you will have the pectoralis major inserting. But for today's session, what we're really focusing on is the fact that the latissimus dorsi muscle is going to have its distal attachment on the floor of the intertubercular sulcus. And then kind of running over that, you would have one of the tendons of your biceps brachii. So a lot is going on in this fairly small region. All right, moving to the cranium, and we are focusing on this bone here shaded in purple, and we are looking at a posterior view here. You can see that this occipital bone is going to be unpaired as opposed to the parietal bones you can see here in the temporal bones. And we're focusing in on these regions right about here. So right here, kind of towards the midline, you're going to have what is referred to as the external occipital protuberance. And this is going to be one of the superior attachments of the trapezius muscle. You can palpate your own external occipital protuberance if you put your hand on the back of your head and kind of feel right around the midline. You should feel a noticeable bump in comparison to the other portions of the bone there, and that's your external occipital protuberance. Extending laterally on either side will be the superior nuchal line. And the superior nuchal line is an important kind of demarcation in terms of superior, kind of the superiormost extent of the neck region. But where we're really more focused on is that this is another superior attachment site of that large trapezius muscle that has extensive attachments. It's that one of those superficial back muscles. And last but not least, let's talk about the iliac crests because they are super cool. We are going to see that these are going to be the superiormost and kind of anterior portions. I went a little too far here. Anterior portions of the ilium. Let's not put that there. Let's start there and go on. So this is going to be, if you put your hands on your hips and you're resting on bone, you are resting right around here in terms of your iliac crests. And this is going to be a component of the ilium, and the ilium is going to be one of the three parts of your hip bone or your coxal bone. The others are going to be your pubis, as well as the ischium, or the more posterior portion. Now, we care about the iliac crest for two major reasons. First, the latissimus dorsi has one of its proximal attachments here. Now, recall that the latissimus dorsi has quite significant proximal attachments, expansive in fact, but this is indeed one. And we will talk more about the abdominal wall musculature, particularly in the gastrointestinal sequence, but you are going to have attachment of those muscles in this region as well. Also, if you kind of connect the lines between the tops of your iliac crests, you are in that supracristal plane, which is about L4 region. So you'd have your fifth lumbar vertebra, and your L4 would be right about there, and that is helpful in some clinical procedures associated with either entering anesthetics or perhaps removing some cerebrospinal fluid in order to test for diagnostic purposes. All right, so that is all the osteology that's not part of the vertebral column, and I can't wait to get into that next video. Make sure that you always feel free to reach out to me if you have any questions on this material, and thank you for your time and attention.